I'm Ted Smith. I'm an associate professor of environmental medicine here at the Christina Lee Brown Envirome Institute at the University of Louisville School of Medicine. Here to share a little bit about a project that we did over the COVID-19 pandemic. Wastewater monitoring for infections and infection containment is a new idea in the Western world. It has utility for surveillance, for monitoring, but it has other utility for active interventions, things that you can do in targeted places. If we know that there are areas in our city where infection rates skyrocket, that is an opportunity for public health to focus vaccination education and vaccination targeted rollout. And so we put together a summary of that general idea for other cities around the world to consider in the Journal of the American Medical Association Health Forum with my co-authors Gail Castle at the Harvard School of Public Health and Arani Bhatnagar here at the Envirome Institute. Doing targeted vaccination, education, and rollout was a novel notion, and it really needed to be considered for public policymakers who have had to watch this field go from a highly experimental, iffy, questionable thing to one of the primary ways that we understand community infection in the United States. Sequencing the wastewater gave us a snapshot into all the ways that this virus mutates. We can see the successful mutations earlier than we'll see them clinically. So that when we create a vaccine, which is a very expensive, time-consuming activity, we pick the right direction, right? Which is critically important, not only for COVID, but for any kind of vaccine. As we move along in our new understanding of public health, there's many ways to return an investment in wastewater monitoring. It's a great companion to vaccination in communities, and that potentially is even more valuable than using it as a thermometer to gauge community infection.